Welcome to Healthcare Channel. Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints in your body. This condition occurs when your immune system attacks the lining of your joints, leading to painful inflammation, swelling, and stiffness. While there is variety of treatments available to help manage the symptoms and slow the progression of the disease. In this video, we will explore some of the most effective treatment options for rheumatoid arthritis. Medications are often the first line of defense when it comes to treating rheumatoid arthritis. There are several different types of medications that can be used to reduce inflammation and ease pain. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, can help reduce swelling and relieve pain. Steroids, such as prednisone, can also be used to quickly reduce inflammation and ease symptoms. Disease-modifying anti-rheumatic drugs, DMARDs, are a class of drugs that can slow down the progression of the disease by suppressing the immune system. Some commonly used DMARDs include methotrexate, sulfasalazine, and hydroxychloroquine. Biologic DMARDs, such as etanercept and adalimumab, are a newer type of DMARD that target specific components of the immune system. These medications can be very effective in treating rheumatoid arthritis but can be costly and may have side effects. Physical therapy. Physical therapy can be an effective treatment option for rheumatoid arthritis. A physical therapist can work with you to design an exercise program that can help improve your range of motion, reduce pain, and strengthen your muscles. Low-impact exercises, such as swimming and yoga, can be particularly helpful for individuals with rheumatoid arthritis. A physical therapist can also teach you techniques to protect your joints and prevent further damage. Occupational therapy. Occupational therapy can help individuals with rheumatoid arthritis learn strategies to manage daily activities with less pain and stiffness. An occupational therapist can evaluate your home and work environments to identify potential challenges and suggest modifications to make your surroundings more comfortable and accessible. They can also recommend adaptive equipment, such as jar openers or reachers, to make everyday tasks easier. Surgery. Surgery may be necessary for individuals with severe rheumatoid arthritis that has caused irreversible damage to the joints. Joint replacement surgery involves removing the damaged joint and replacing it with an artificial joint. This can help reduce pain, improve mobility, and enhance overall quality of life. Joint replacement surgery is most commonly performed on the knees and hips but can also be performed on the shoulders, elbows, and ankles. Lifestyle changes. Making certain lifestyle changes can also be an effective way to manage rheumatoid arthritis symptoms. Maintaining a healthy weight can reduce the strain on your joints and help slow down the progression of the disease. Eating a balanced diet rich in fruits, vegetables, and whole grains can help reduce inflammation in the body. Quitting smoking can also help reduce inflammation and improve overall health. In conclusion, while there is no cure for rheumatoid arthritis, there are several effective treatment options available to help manage the symptoms and slow the progression of the disease. Medications, physical therapy, occupational therapy, surgery, and lifestyle changes can all be effective in reducing pain, improving mobility, and enhancing overall quality of life. If you or a loved one are experiencing symptoms of rheumatoid arthritis, it is important to speak with a healthcare professional to determine the best course of treatment for your specific needs. Thanks for watching. Subscribe now for more information.